We are live. We are live. We are live. I'm Dr. Frita, and welcome to Medical Monday, where I give you all of the hot health headlines in the news. Listen, we have a jam-packed day today. We're going to start off with my favorite game, Myth versus Fact, and we're going to talk about Wendy Williams and everything she's been going through, because Wendy says that she is not permanently incapacitated and she does not need that guardian. That's what she says. So we'll talk about myth versus fact when it comes to frontotemporal dementia and even alcohol-induced dementia. And then we'll move into your weekly dose of medicine, where I give you a fresh take on the headlines that you just won't see anywhere else. We'll open up starting with asthma. There was a young man who had a diagnosis of asthma, and because the price of his inhaler increased all the way from about $30 to over $500, he was unable to afford the inhaler, and he ultimately died from an asthma attack. And so we'll dive into that and the implications of asthma and of healthcare insurance. What are their responsibilities? And then we'll talk about one of the Real Housewives alums, Teddi Mellencamp, who has shared her diagnosis of having brain tumors. She had to have a couple of them removed. And so we'll talk about brain tumors, signs, symptoms, and what you need to know. Then we'll talk about a judge who ruled that, unlike the executive order or the federal decision to remove health information from websites like the CDC, the judge has now ordered that the information has to be on there for doctors to see, for patients to see. What do you think about that? Are you excited? I know I am. And then we'll talk about, the bird flu, because a human being in Ohio has a diagnosis of the bird flu. Is the bird flu coming near you? I hope not, but we'll talk about what to do about it. And then in a rapid fire segment, we'll do a 5-minute health check where I'll give you all kinds of information on food recalls, other disease outbreaks, and I'll just do a rapid fire on things you need to know. We'll have a little time for a live Q&A for my members, especially. If you want to join the full membership, click the link in the description. And of course, this is a live Medical Monday, and so you'll have a chance to interact with me all throughout. So please go ahead and give us a thumbs up, give us a like as you come in, because it's Medical Monday, and we're about to have a great evidence-based medical show. I'm Dr. Frita. Hello, hello. We are live. I'm Dr. Frita. We're about to go ahead and get started with this hot health topic filled live. You know I'm not going to do it alone. Shador, please come on up to the stage.
Hey, Dr. Frita.
Hey, Miss Shador. How are you doing today?
Doing pretty good. Hey, everyone.
You had a good weekend, I hope, Shador?
Yep, my weekend's pretty much the same. Nice and relaxing.
Oh my goodness. Mine was relaxing to me, probably busy to most people. Shador, I got a chance to go back in studio and film Good Day Atlanta. I love doing that. I was with their journalist and anchor, Caitlin Pratt. And guess what? I did another segment on Good Day Atlanta called Health Headlines with Dr. Frita. And so I will be posting that. And for members, I'll be posting you a sneak peek today. So make sure, for all of you who are members, go ahead and this afternoon take a peek, and I'll have the whole interview there, and then I'll release it in general a little bit later than that. But we had a really great time on that show. And other than that, I had a pretty good weekend over here. Well, I hope, Shador, that Wendy Williams is having a good weekend, because, you know, she did that Tubi documentary with the good folks at TMZ, and they showed her being interviewed, and she was up in her room at the luxury prison, as she calls it. And she really did sound pretty lucid, in my opinion. Is she totally perfectly all the way back to 100% Wendy Williams? I don't know, but she definitely is not fitting that description of being permanently incapacitated. And she's not necessarily fitting the frontotemporal dementia hits and characteristics. So let's play that clip, Shador. And then to my members and all of you who have joined the chat, thank you so much. We're going to play my favorite game, Myth versus Fact. And then on a serious note, we will be breaking down some information on frontotemporal dementia and alcohol-induced dementia.
Looking at you behind that window, which is the only way I can communicate with you now, it feels like you're screaming for help. Are you allowed to go out?
No. In the last 30 days, I went out twice.
This sounds more like a prison than independence.
I want my rights back. I want my freedom back.
TMZ presents Saving Wendy, now streaming on Tubi.
All right. Shador, who was the first person in the chat?
First person today, Dr. Frita, is Randy. Randy
Hi,
says,
Mr. Randy.
good afternoon, Dr. Frita and Miss Shador. Hi,
Hello,
Mr.
hello.
Randy. And shout out to our member, Sarah. Hi.
Hi, Sarah. Glad you're a member. Yes, Sarah, check it out. This afternoon, I'm going to put my whole entire conversation from Good Day Atlanta, and I'll give my members the first view. All right, good deal. Thank y'all for joining. Thank you, everyone, for joining. Please go ahead and hit that thumbs up, hit that like, share, let people know we're here because I'm going to give you really an earful of evidence-based information. All right. Now, I do want to know, did anyone actually watch the Tubi documentary of Saving Wendy Williams? If so, put a WW in the chat. Put a WW in the chat. Meanwhile, let's go ahead and get started with myth versus fact. Shador, could you please read that first myth versus fact statement?
Absolutely. Alcohol-induced dementia can be reversed with treatment.
All right. Alcohol-induced dementia can be reversed with treatment. Put an M1 if you think that's not true, if that's a myth. Put an F1 if you think that's true, that there's a chance that alcohol-induced dementia can be reversed with treatment. All right. Next question or statement.
Aphasia is always a sign of dementia.
Aphasia is always a sign of dementia. And remember, Wendy Williams' guardian has shared that Wendy has primary progressive aphasia. So aphasia is always a sign of dementia. Put an M2 if that's not true. Put an F2 if that's a fact, and it is true. All right, pencils down. Let's see here. I want to know who participated. Y'all know I love it when you participate. And so we'll break these things down as we get our answers. Yep. Did anyone say that they watched that documentary?
Yes, they did.
All right. Tell me who.
So watching the Wendy Williams documentary, we have Andrea.
Hi, Andrea. Okay.
Miss V.E. Hall.
Hey there, Miss V.E. Hall. Good to see you.
And FJ.
All right, FJ. All right, so y'all watched it on Tubi. All right, so hopefully y'all will be participating in this conversation because we are going to talk about alcohol-induced dementia and frontotemporal dementia. And those are a couple of the headlines I talked about on Good Day Atlanta for that clip I'm going to release. All right, Shador, let's start off by tackling myth versus fact statement number 1.
Yes.
All right.
Alcohol-induced dementia can be reversed with treatments.
Alcohol-induced dementia can be reversed with treatments. All right. Who said that's a myth? Who said that's a fact?
So overwhelmingly facts on this one. We have a couple of myths sprinkled in. Miss Deborah.
Okay.
Says a fact.
Miss Deborah said it's a fact that can be treated. Okay.
Mm-hmm. Therese agrees.
Okay. That it can be treated. Okay.
Miss Brenda.
Oh, everyone says it's a fact.
Brenda
okay.
says a myth. She's on.
She says it's a myth. Okay, Miss Brenda, you think it's a myth? You think by the time you have alcohol-induced dementia, just like with other types of dementia, like Alzheimer's, you think that that's it. That's what you got. Mm-hmm. Okay.
Tisha thinks it's a fact.
Tisha, oh well, optimist thinks it can be treated. Mm-hmm. All right, Tisha.
And also Anthony
says it's a fact.
Says it's a fact.
All right. So alcohol dementia can be reversed with treatment. That's a fact. That's a fact. So let me explain. Let's talk about alcohol-induced dementia versus frontotemporal dementia. So when we're talking about frontotemporal dementia, which is what the Guardian, Sabrina Morrissey, says that Wendy Williams has, we're talking about an illness or a form of dementia where you get a degeneration of the frontal lobe, which is right here behind the forehead, and the temporal lobes, right? And we don't actually know the cause of it, but we do know that it's progressive, okay? And there's no known cure. There's different treatments and support, but no known cure for frontotemporal dementia. So if someone has that diagnosis, you expect them to get worse and worse and worse, unfortunately, over time. Could they wax and wane and have some days that are better than others? Of course. But we generally expect people with frontotemporal dementia to progress, get worse, and there's no known cure for frontotemporal dementia, okay? And you will have symptoms, some that we saw in Wendy Williams when she did that documentary, where you'll have a loss of impulse control, difficulty with speech, difficulty speaking words, difficulty finding words. You might have issues with balance. You might lose your ability to have executive planning your everyday. These things are true for frontotemporal dementia, okay? Now with alcohol-induced dementia, unlike frontotemporal dementia, we do have a cause. Of course, the cause is alcohol. And I'm talking about very high amounts of alcohol. Some scientists say that a woman needs to drink 25 drinks a day, a man over 35 drinks a day, something like that. So extreme amounts of alcohol, and it can cause different syndromes. A Wernicke-Korsakoff syndrome, where you can have confabulation, where you're speaking, you're saying words, they don't necessarily make sense. You can certainly have memory issues, difficulty finding language as well. And the thing about alcohol-induced dementia, even though a lot of the symptoms overlap with frontotemporal dementia, the key in alcohol dementia is that, especially if it's caught early on, it actually can get better. It can get better in two ways. One, if you stop the offending agent, meaning you stop alcohol use, okay, there's a potential that you get better. And here's another very important part of the treatment, and that is a specific vitamin replacement, vitamin B1 or thiamine. Oftentimes people with alcohol-induced dementia are vitamin deficient. And if they're deficient in vitamin B1, then that can affect their memory, language, speech, balance. And so if you replete that vitamin, and it truly is alcohol dementia, plus you stop the alcohol, then these are treatments that can make alcohol-induced dementia better. Will everyone get better? Will someone who's been drinking for 50 years get better? Not necessarily. But in Wendy Williams, we see that it does at least appear in the snapshots we've had that she's not the same person who was on that documentary. And the fact that she seems to be cognitively improving in the recent interviews, it just goes against the natural history of frontotemporal dementia. So yes, that's a bit of a tricky one, but in alcohol-induced dementia, it potentially can get better. And the reason we're mentioning that today is because in that original Lifetime documentary with Wendy Williams' son, Kevin Jr., said that he was told that his mom had alcohol dementia. And then as the documentary progresses, we see that The Guardian said that it was frontotemporal dementia. Okay. All right. That's very interesting. All right. Thank y'all for that participation. Let's do the myth versus fact number 2, por favor.
My apologies. Aphasia is always a sign of dementia. So the other way on this one, Dr. Frita.
Okay. So a lot of people said myths. So let's talk about aphasia. So aphasia is always a sign of dementia. We know that aphasia is when we're talking about difficulty with speech. Okay. Difficulty with speech. Okay. So who says that aphasia is always a sign of dementia? Who says this is a fact?
Our fact takers are the attitude.
Ooh, attitude. All right.
And Mark also says a fact.
Hi, Mark. So you think aphasia is always a sign of dementia? All right. Who says it's a myth? Not always.
Our myth takers are Dr. J.
Hi, Dr. J. Welcome.
Carolyn.
Hi, Carolyn.
Miss Robin.
Miss Robin.
And Anton.
So y'all say aphasia is not always a sign of dementia. The answer is this was a myth. Aphasia is not always a sign of dementia. Now, so aphasia, when you're having difficulty with language, certainly can be a sign of dementia. And in frontotemporal dementia, one of the subcategories is primary progressive aphasia, where the patient has difficulty speaking and also difficulty processing language. Okay. And that's because of the temporal lobes, kind of right over your ears on the side of your head. That's where your temporal lobes are on your brain. But there are other things besides dementia that can cause aphasia. Brain tumors can cause aphasia if you have a tumor affecting the lobe that controls speech. Traumatic head injury can cause aphasia. I know, as I say it, I know it's making sense to y'all as I say it. You can have a temporary or a transient ischemic attack, like a mini stroke, as they call it. That can cause aphasia. And motor vehicle accidents, again, causing a traumatic brain injury in certain sports. Traumatic brain injury, anything affecting the temporal lobe can cause aphasia, difficulty with speech. And so while, yes, dementia can be associated with aphasia, aphasia is not always a sign of dementia. Oh, and people can have dementia and not have aphasia. Okay. So that's one of those questions. And when you think about, did any of y'all ever take little test taking skills classes like SAT prep and things like that? When you see always and never, you really have to pause and step back on the question. All right.
It's funny you mentioned that, Dr. Frita.
What's that?
It's funny you just mentioned that. Stephanie stepped in. Stephanie says, any choice with always is not the right answer.
Ooh, wait a minute now, Stephanie. Sometimes it is, but you're right. When I see always and never, because if you see always, all you have to do is come up with one example where it's not true, just one example, and then it takes it away. Same thing if you see never, come up with one example where it's true, it takes it away. All right, test taking skills, Stephanie. I see you. All right. And so, again, I will be posting my entire interview where on Good Day Atlanta, on our local Fox 5 Atlanta, I talk about the Wendy Williams, and I talk about is she permanently incapacitated? I'll give the first look to the members, and then I'll post it for everybody coming soon. And remember, if you would like to join us for live Q&As, join the membership. If you would like to see different videos that I have for members only, where I give you behind the scenes breakdowns, join the membership. If you want to get special shout outs and emojis and loyalty badges here during our lives, join the membership. We have a few different levels, so make sure you click the link in the description. We're having a great time. And if anyone will tell you, if you join our live Q&As, you get a chance to talk with me, ask questions. And these are serious questions, because for those of you who are new to our Dr. Frita channel, first of all, I just want to thank everyone who supports us and who subscribes. We are up to over 833,000 subscribers on this channel. We are slowly marching to 1 million. So thank you to all of you who are subscribers. And for those of you who aren't subscribers, why not? Hey, hit that subscribe button. Come on, join us. We have a great time. But specifically, as far as what I give you in the lives, I am Dr. Frita. I'm an MD. I'm a medical doctor who has been quadruple board certified. So I've been board certified in nephrology. That's what I practice now. So I'm a board certified kidney doctor and high blood pressure doctor. I also have been board certified in internal medicine and pediatrics. I got those certifications right after I completed my Med-Peds residency at Georgetown University Hospital School of Medicine, and then came on to Atlanta, where I completed my fellowship in nephrology. And then most recently, I got my board certification in obesity medicine. I say that to say that yes, we have fun. Yes, we laugh. But if you join that membership, specifically the tier where you get a chance to have the live Q&A, you get your questions asked. I give you perspectives, and you have access, and where we just sit there and go back and forth with questions the whole time. We have a good time, but it's an educational good time. So please go ahead and give us a join. All right, let's move on to our weekly dose. Okay, let's do our weekly dose of medicine, where I give you a fresh take on the headlines that you can't get anywhere else. This one, Shador, is particularly upsetting to me. There was a young man with a known diagnosis of asthma. He was on a controller med. We'll talk about that, a controller med that you take daily for asthma. But his insurance company no longer covered the medicine. And so it jumped from being what was affordable to him to costing $539. We're talking $539 a month for an inhaler. And this young man made $19 an hour, simply could not afford it. And so he skipped it. Fast forward, he is no longer alive. He passed away due to an asthma attack. And so what I want you to do is, as we go ahead and listen to this clip, everyone in the chat, please comment. Do you think that his health insurance company had some type of an obligation to let them know, hey, we're about to not cover your inhaler? Do you think the pharmacy had an obligation to say, we don't cover it, but here, let us help you to find another inhaler that's covered? Or do you think, oh, well, it's his fault? Big deal. I want y'all to comment in the chat what you think. And Shador, let's go ahead and play this clip, please.
Now to the issue of rising health insurance costs. The family of a man who died after an asthma attack wants answers about the cost of his inhaler.
This morning, a Wisconsin couple is describing their heartbreaking loss, saying their son died from an asthma attack after choosing rent over medicine.
Walking into that ICU and seeing him like that, there's no way to prepare a parent for that.
22-year-old Cole Schmidtnick treated his asthma with an Advair inhaler, costing $66 a month. But last year, his family says Walgreens told him the inhaler was no longer covered by his insurance and would cost $539, 8 times more. Unable to afford it, Cole left the store without it.
He made $19 an hour. He worked full time. He had his own insurance. However, he couldn't afford $539.19.
5 days later, Cole's family says he suffered a severe asthma attack, later dying at the hospital. His family is now suing for negligence, arguing Optum Rx, a subsidiary of United Health Group, should have given Cole advance notice. They also claim Walgreens should have contacted Cole's doctor or offered him a more affordable workaround.
We had to fight now on his behalf and be his voice for justice, not only for him, but for all of us.
Walgreens said it could not comment due to the pending lawsuit. Optum Rx said it's saddened by Cole's story, adding his case was handled consistent with industry practice and the patient's insurance plan design.
Just last month, the top manufacturers of inhalers, including the one Cole used, agreed to cap the cost at $35.
Thank you. Shador, that story hits home. And so I mentioned that I did a dual residency, internal medicine and pediatrics, when I was in DC at Georgetown University Hospital School of Medicine. And when I was in the PICU, the pediatric ICU, doing rotations there, I watched children come in with severe asthma attacks. And sadly, I have seen children die from severe asthma. I think that asthma is something, it's a term. Oh, I got asthma. Oh, yeah, my brother got asthma. Oh, my classmate has asthma. We throw the term around and it seems so common that I don't think that as a unit in general, I don't think as a community, we have a full understanding that asthma kills. Okay, asthma kills. And if you're someone with asthma and the only thing that you have is an albuterol inhaler, okay, like the fast acting inhaler, then that's probably okay as long as you're having symptoms less than twice a week. But if you're having to use that inhaler every day, or even waking up at night to use the inhaler, then your asthma is not controlled, whether you know it or not. So for me personally, I'll share that my 14-year-old son, has asthma. And that same inhaler, Advair, is what my son takes or took. But guess what? Time rolled around, insurance stopped covering it. And so I was like, that's okay. Advair is what works for my child. I'll pay. And same thing, the inhaler, over $500 a month. Now, granted, and thankfully, if I absolutely had to pay for his inhaler, I would have paid for his inhaler. It's not right, but I would have, and I could have out of, being blessed to be able to do so. But I still fought it. And even though I fought it, the insurance company didn't budge and they did not cover the Advair. Did anyone comment on who they think is at fault?
Yes, ma'am. Absolutely. We have a couple of takers on the subject. Sheree. Hi, Sheree. Sheree says both pharmacy and insurance company, but ultimately the insurance company.
Okay.
Anthony says insurance companies should have found a more affordable solution. The pharmacy only intervenes when asked.
Okay.
And Ton thinks the insurance company should have let him know, and the pharmacy should have worked with him to find something else.
Yeah, I agree. Because for so many people, it's difficult to find what medicine works. And when you find it, you stick with it, period. And I'll say for my particular pharmacy, they did give me all these, substitutes I didn't want that were covered. But they did do their due diligence by giving me that. And to my knowledge, the insurance company did not give me a warning, but I feel like it's just so frustrating. Yeah. So let's talk about asthma. And I want you to put a 1 in the chat if you know someone, loved one, anyone who has asthma. Put a 1 in the chat because this is very important. A lot of people don't know what asthma is. So Shador, if you could pull that slide up of what asthma looks like. So asthma is a chronic condition, and it occurs when your breathing tubes, your bronchioles, actually become inflamed. They tighten. Okay, they get smaller, and you can also get mucus production. So what happens if your air tubes get inflamed and mucus production? Well, it's difficult to breathe. And so if you imagine yourself taking a coffee straw and go out, run a lap around a football field at top speed, and then someone tells you have to breathe through the coffee straw, that would be very difficult, right? Well, that's essentially how people with asthma live, especially when they're having an asthma flare. Okay, so it's a constriction, inflammation of the breathing tubes plus mucus production. Now, asthma can be triggered by different things, by exercise in some people, by allergens, by dust mites, by cockroach dander. Some people's asthma will be triggered by cold weather. But the key is knowing what type of asthma you have. And so for everyone who's listening, I want you to make sure that you share the information I'm about to give you with loved ones or anyone who has asthma. Okay, so there's different categories of asthma. So if you have just a mild intermittent asthma, that means you're getting symptoms like less than twice a week. All right. And by symptoms, you may know the symptom of wheezing, but for some people, wheezing is not actually a symptom. For children, someone put in the chat if you know a common asthma symptom that you'll find in children, not just wheezing. But either way, if you're getting wheezing or this other common symptom I'm about to share, less than twice a week, then that's considered mild intermittent asthma, especially if you're not getting very frequent nighttime symptoms. And you might be okay with just the albuterol or the short-acting inhaler. It's a beta agonist. It helps to dilate the lung tubes, and that's fine. But if you have a higher level, like if you have a moderate persistent or even a severe asthma or even a mild persistent, then the short-acting inhaler might not be enough. And so if you know someone with asthma, if you have asthma and you're using your inhaler more than twice a week, I need you to please consult with your doctor right away, because you may be at a level where you need a long-acting inhaler, and that's what the Advair was. That's where you'll have an inhaled steroid and then an inhaled long-acting form of albuterol or long-acting beta agonist that helps to dilate your lung tubes. So just think about it. If you know someone who's using that inhaler more than twice a week, okay, and if they're having night symptoms pretty frequently as well, then they may need a long-acting inhaler, or else they could also get in a bind where they can have a major issue in an asthma attack. All right. Let's see. Did anyone comment if they have asthma or know of someone with asthma? Shador?
Yes, quite a few.
Okay.
Logan says
Logan
has asthma.
Okay. So Logan, I hope that if you have an inhaler, you're using it less than twice a week. Now, if you have exercise-induced asthma, and if you use it like before you go on the treadmill or something, I'm not necessarily talking about that. But if you know that you're wheezing more than a couple times a week, you might need a long-acting. So make sure you consult with your doctor. Yeah.
Yeah. And Logan chimed in. Logan said the pharmacy got me a cheaper inhaler than Advair, and it works well.
Good. Yeah. And for my son, I ended up switching, because they did find me something that was similar to the Advair. It had the long-acting steroid, it had the long-acting beta agonist, and he's doing great on it. But you have to know that that's available, and that's what the pharmacist should be doing, telling you what's available. For that man, he might have just thought Advair is what works for me. I don't have a medicine. Yeah. Thank you for sharing, Logan.
Yeah, absolutely. Now I remember Miss Rosalind.
Hi, hello to my member.
Hi, Miss Rosalind. You know someone who has asthma.
Yes. I'm going to put up a chart, and I want you to screenshot the chart once we put it up and share it, especially if you're close enough. Look, even when I'm not close to people, I give them my 2 cents. And at very least say, hey, are you having symptoms more than a couple times a week? If you're not on a long-acting medicine, perhaps you should consult with your doctor. Yeah.
Dr. Frita, Miss Brenda, she says, I have eosinophilic asthma, 2 daily inhalers and monthly injection.
Okay. So the eosinophils is that? Okay.
Yes.
So you have like an allergic kind of reaction. That's what the eosinophils will mean. Okay. So you know the real deal. And if someone all of a sudden jacked up the price of your inhaler from $66 to $539, you might feel it, someone who's completely independently wealthy might not, but even someone independently wealthy might just get mad because it doesn't make sense. So yes, I'm sure you would appreciate a warning from the insurance. First of all, you'll appreciate them leaving your medicine alone, but I'm sure you would appreciate a warning if they had to change your medicine. And certainly you would hope that the pharmacy advocated for you. Thank you for sharing. And I hope that you do well. Okay.
Absolutely.
Very good. All right, Shador, if you could put up the slide. This next slide breaks down those categories I was talking about on the different types of asthma, the mild intermittent versus the mild persistent, moderate persistent, severe. And so you can screenshot this if y'all are looking, especially if you know someone with asthma, if you have asthma, and it kind of lets you know on where you are as far as your daily symptoms, your nighttime symptoms, things of that nature. And it'll help to give you an idea. If you have asthma, certainly it's recommended that you use a peak flow meter to let you know the variability as far as how your breathing is going, so that you can kind of know when an asthma attack is coming in, so you can be proactive. But yeah, if you're requiring that inhaler more than twice a week, then the albuterol, the short acting one, is likely not enough. Consult with your doctor. Yeah. And another thing to know is that who's affected. Women tend to pass away from asthma more than men, but when it comes to children, non-Hispanic Black boys die from asthma more than any other race. When it comes to adults, non-Hispanic Black females die more. And there are certain triggers we talked about, but a big one is smoking cigarettes. I remember when I would be working in the newborn unit and I would ask parents, hey, do you smoke? And they're like, yeah, I smoke, but I don't smoke around the kid. The cigarette smoke is still in your clothes. And so I would encourage them, of course, not to smoke. But if they were going to smoke, I would say, go have a smoking outfit. And if you come in, change clothes. Now, I can't eliminate the smoke that's in their hair, the smoke that's in their nostrils, but smoking is a huge trigger and a risk factor for developing asthma. All right. So I'm certainly praying for this young man's family and loved ones. And I do hope this brings a good light as far as advocating for protection of people with chronic diseases, being protected from insurance companies, and for pharmacies to advocate more.
Absolutely. And Dr. Frita, you asked what's the number one sign in children of asthma attack other than wheezing?
Any answers?
We had a couple of chime in with Sarisa.
Hi.
Miss V.E. Hall.
Okay.
And Robin. I'll say
coughing. You said coughing?
Yes.
Exactly. Listen, and it's easy to miss. So especially if y'all know anyone who is around children, like teachers, Sunday school teachers, camp leaders, make sure that they are aware that coughing is not just wheezing, because you'll see kids running and playing and they'll stop, they'll lean forward, put their hands on their knees, and they'll cough. They might never wheeze, but if they're coughing, that could be a sign that they're having an asthma attack. Other signs of asthma attack can be nostrils flaring. Okay, that's a sign of respiratory distress. If you look at your kid or other kids and their neck muscles, their accessory muscles are being used, that could be a sign of an asthma exacerbation. If their stomachs are going up and down where you're seeing their ribs, that's accessory muscles. That can be a sign of asthma exacerbation. So there's more to asthma than wheezing, okay? So make sure you're aware. Thank y'all. Listen, my medheads, y'all are a smart group. Very good. All right. So do any of y'all watch Real Housewives, any of the franchises? Put a 2 if you watch any of the Real Housewives franchises and say your favorite one. Is it RHOA, Real Housewives of Atlanta? Is it RHOB, Real Housewives of Beverly Hills? RHOC? Tell me what your favorite one is and put a 2 if you watch any of the franchises. Well, is a young lady, Teddi Mellencamp. I guess John Cougar Mellencamp is her dad, a very famous singer, award-winning singer. Well, she was on this show. She's an alum now, and she's had different health issues that she's scared. She is a survivor of melanoma. We know it's a very aggressive form of skin cancer. She also, prior to being on the show, was living with obesity. Now she's at a healthy weight, and she's very into fitness. We know that. But she shared recently that she was having severe headaches, went to be evaluated, and she had multiple brain tumors. So let's play that clip, please, Shador.
Love you, babe. You got this. Teddi Mellencamp reveals she has multiple brain tumors. The Real Housewives of Beverly Hills alum takes to Instagram February 12th to share a health update after being hospitalized for debilitating headaches. She writes in a February 12th post, "For the last several weeks, I've been dealing with severe and debilitating headaches. Yesterday, the pain was unbearable and required hospitalization. After a CT scan and MRI, doctors found multiple tumors on my brain, which they believe have been growing for at least 6 months. Before continuing, 2 of the tumors will be surgically removed today. The remaining smaller tumors will be dealt with via radiation at a later date." She goes on to thank her loved ones as well as healthcare professionals. "I am blessed to be surrounded by my children, family, friends, doctors, nurses, and surgeons who are doing everything possible to get me back into better health." Teddi also shares videos of one of her friends shaving her head before the surgery.
All right. Yeah, that's something. I know she's a mother. She's very active in the community. And just like that, she's having brain tumors. In the chat, I want y'all to please write down what you think some of the symptoms of brain tumors might be. What are some of the symptoms of brain tumors? And we've talked about them right here on this show before. We talked about Michael Strahan's daughter having a brain tumor, the medulloblastoma, Isabel. And, she had surgery, like she was diagnosed like the day before her 19th birthday, but she's been really showing that on her social media. Plus, I believe they have a documentary out, Michael Strahan and his daughter, Isabel, just showing what it's like to live and then rejoin life as you knew it with the brain tumor, and perhaps life in a way you didn't know it. The medulloblastoma is one that's common in pediatric groups, and it's actually cancerous, okay? It's malignant. And then we talked about also Megan Thee Stallion's mother who passed away with the brain tumor. So we know that's happened. There's some other people, like a famous senator who's had a brain tumor. Ted Kennedy, he no longer is with us. And even President Joe Biden's son, Beau Biden, passed away with a brain tumor. They had malignant tumors or cancerous tumors, glioblastomas. And so, you know, brain tumors are here, and it's important because we don't have a typical routine screening for brain tumors. And so it's important to recognize the symptoms. Did anyone in the chat write down what a symptom of a brain tumor might be?
Yes. Marina.
Hi, Marina.
Says blurred vision.
Blurred vision could be, especially if the tumor is sitting in a place like a pituitary tumor, where it's affecting the nerves that help to control your vision. Then yes, you can get blurred vision. Or if the tumor is in the back of the brain, in the occipital lobe, that helps to control vision. Or if the tumor is just causing an increased pressure in the brain, an increased intracranial pressure, it can also cause a pressure on the eyes and on the nerves and cause blurry vision. So yes, that could be a symptom of a brain tumor. Thank you.
Stephanie had a class today, Dr. Frita. She named a few.
Hi, Stephanie.
AMS.
Okay, so altered mental status, AMS. Yes, you can certainly get confusion. Altered mental status, good.
Neurological focal deficits.
Yes. So depending on where the brain tumor is, if it's on the part of the brain on a temporal lobe that controls speech, you might have a slurred speech. If it's on a part of the brain that controls your motor functions, you could get a weak hand, weak leg, a drooping. So yes, you can have different deficits depending on where the tumor is and what part of your body functions the brain controls. Very good.
She also chimed in with seizures.
Definitely, you can get seizures. You're interrupting the neurological flow of the brain. And so it could cause some type of a hyperreactivity and a seizure. A brain tumor can. These are excellent. Thank you, Stephanie.
I am paralegal.
Oh, hey, I am paralegal. Ooh, I want to know if you have anything to say about Wendy Williams, and do you think she'll get out of this guardianship? I know we don't know, but I know you have something to weigh in on it. All right, what are you saying? I am paralegal.
Headache, vision, and balance issues.
Absolutely. Headaches. In fact, that's what Teddi Mellencamp said, that she had severe headaches. And for people, especially who tend to get headaches, you might downplay them and say, oh, it's just another migraine. But even if you're someone who gets headaches, if you get migraines, you know when the headache is different from the norm for you. And if you're someone who normally doesn't get headaches and all of a sudden you're getting these intense, severe headaches, please, please, please go to your doctor immediately. Don't wait. Go to the emergency room because it could be a brain tumor. So absolutely. Yes. And what else?
OG, what else did a paralegal say?
Yes.
Oh, vision and balance issues.
Okay. Yes. Very good.
OG Nadine says red eyes.
Red eyes. So imagine if you were getting red eyes, if you had some type of an intracranial pressure. That's not one of the classic top symptoms that comes to mind. I will say, though, in keeping with headaches, there's one headache. Oh, gosh, cluster headaches. We've talked about it on this live before. Cluster headaches can be associated with red eyes. But yes, I imagine if you had some really increased intracranial pressure or even something that was causing the eyes to pop forward, a proptosis. Yeah, but red eyes is not one of the top symptoms that comes to mind.
And then Stephanie chimed in with one more: vomiting with increased intracranial pressure.
Absolutely. Absolutely. If you have increased intracranial pressure for any reason, that could lead to nausea and vomiting. So yes, vomiting, and oftentimes early morning vomiting, although it could be any time of day, can be associated with brain tumors. So yeah, the confusion, the altered mental status, the severe headaches, the vomiting, the focal deficits, be it weakness, facial droop, things of that nature. Some people with brain tumors can also have some personality changes, especially if the frontal lobe is affected, because that tends to be responsible for your personality and your judgment. So just make sure you pay attention to your bodies, you get your routine health checkups with seeing your doctor, and most importantly, don't ignore your symptoms. You're important enough to take care of you. If it's a symptom and you know that you're having it, but if a loved one came to you with the symptom, if you would tell them, ooh, go to the doctor, then at least treat yourself as well as you treat your loved ones. Okay. Thank y'all. All right. So for this next story, it's driving me bananas. Y'all know, and we talked about it here with the new administration, okay, with Trump, he made a lot of executive orders, too many to remember sometimes. But as far as ones that affected health, we know that there was an order where the CDC and different health websites were no longer giving updates. Okay. So that means we weren't necessarily getting the updates on where we were in flu season, not getting the updates on, like for people with HIV, how to do HIV screening, certainly not getting the updates on contraception anywhere on medical websites that mentioned genders other than male and female. That was wiped. And so there's some valuable information that's linked in there with the gender information. And so just like that, we were cut off from a lot of the federal information. Well, a judge has reversed that decision, and now doctors, patients, all of us have more access to medical information on these federal sites. Shador, let's play this clip, please.
Now the clock is ticking for the Trump administration to restore some websites wiped from the internet. Late last month, a number of government sites went dark to comply with an executive order requiring agencies to scrub terms related to gender ideology. It impacted public health pages and data sets posted by the Centers for Disease Control and the Food and Drug Administration. Today, a federal judge ruled the information must be restored to those sites by midnight.
Unbelievable. All right. Anyone in the chat, I want you to tell me what you think. Do you think that this is kind of not a big deal, or do you think that, it's pretty great that it was restored? Full disclosure, I think it's great that it was restored. That was actually a very big deal to me. I'll tell you what else is a big deal as I see if anyone's going to weigh in. Y'all know that, being a physician, being an MD, being someone who does a lot of public speaking, a lot of health outreach, making sure that we have public safety and public health is a priority. Making sure that we have proper information on proven treatments and proven prevention, that's very important. Well, we now know that RFK Jr. has been confirmed as being head of HHS. And one thing I will say, that for any of you who watched the hearings, there were even people who were Republicans, physicians who were Republicans, who actually brought up the fact that RFK Jr. has been over a lot of anti-vaccine departments. He's been involved with anti-vaccine documentaries that were aimed at the Black community, even with vaccines that we know have helped to decrease diseases. And, sometimes I sit and I wonder, because of course I do the studying, I do the history, and I wonder, like, for some of the new vaccines, the modern vaccines, even if I don't agree, I can understand people having questions about vaccines that are new. They're not sure. They want more people to try them. How do we know? But for things that have been tried and true, like the measles vaccine, we know people died every year from measles, children. When we talk about the polio vaccine, where we had millions of people getting ill, getting paralyzed, even Senator Mitch McConnell shares publicly why he did not vote for RFK Jr. He's a Republican who did not vote for RFK Jr. He just doesn't like the anti-vaccination rhetoric, knowing that the vaccines have saved his life. He had polio as a child, so even he has spoken out. And, when we look at smallpox, which has been eradicated here, but used to kill most of the children it infected. And so I stop and I think sometimes, and I'm like, why aren't people more afraid of these diseases? And the answer is, why aren't you afraid of the boogeyman? Because you've never seen him. And so my great fear is that if we have someone who's now over public health, who disregards even the things that have been proven by fact, I'm talking about the old school vaccines. What I'm hoping is that we don't get a high outbreak. And so I just hope that no one has to see the boogeyman. But meanwhile, I'll keep educating on this channel. And if you go to my video right here on the Dr. Frita channel, I have a videos on the truth about immunizations, where I take you through the history, and I also take you to the microbiology of how vaccines work. Take that information, do your reading, talk to a healthcare provider that you trust, but make sure that you don't fall into a trap that might be harmful to you. Because I will say another thing about RFK Jr., his very family member, JFK Jr.'s daughter, said that while he talks about anti-vaccine rhetoric, his children were vaccinated. So be careful of the person who will vaccinate their own, but tell you that you and your entire community even doesn't need the same level of vaccines. And we remember that with Trump, when he was with the people and talking about, these vaccines, Trump ran and got his vaccine as soon as it was available. So when you're looking at the powers that be, watch what they do. Don't just listen to what they say. All right. Did anyone make a comment about what they think as far as the federal government and putting the sites back up, giving us access?
Yes. We got a couple of chime in.
Okay.
Marina says it's a very big deal.
I agree. And it's a little scary because I look around, I'm like, huh? And so one thing that I'm going to be committed to is not being silent. I'll give you my opinions and let you know when they're opinions, but I'll also give you evidence. Okay. I'm an evidence-based medicine person. And on this channel, I have hundreds of videos. And for the over 830,000 subscribers, I appreciate you. And I know you know that I tell it to you straight and I back it up. Okay. So even in times where I am concerned about the leadership, I will continue to speak truth to power. Okay. So if you enjoyed that type of information, please make sure that you like this video, that you share it with loved ones, and we'll keep on moving. All right. All right. So now, y'all know what I don't want to talk about? The bird flu, but it's here. We have at least 68 confirmed cases, and Ohio now has a human who also has the bird flu. So let's play that clip. And then I want to ask you. So once we finish the clip, what I'm going to ask you, to all of my med heads, tell me ways that you can prevent getting the bird flu. All right, let's play the clip.
Developing tonight, Ohio has confirmed the state's first human case of the bird flu. The Department of Health reports that an adult man, a farm worker in Mercer County, has been infected. That's near the Ohio-Indiana border. Officials say he was in contact with dead birds that were infected with the virus. So far nationwide, 68 people have been diagnosed with the bird flu.
Now, I'm very sorry that's happened to that man in Ohio. And for those of you who are regulars, y'all know that we have said right here on this live several times, if you see a sick bird or a dead bird, do not play with it because it could have the bird flu. See, more people need to watch these lives and we can prevent things. But did anyone say how you can get the bird flu in the chat?
No, no one's chimed in just yet.
Okay, well, we know from this man in Ohio, you can get it from playing or handling dead birds. And, you know, and we talked last week a little bit on how there were different birds around Lake Michigan who were sickly, were dead. And, you know, it's just more bird flu. And we also talked about how more cattle have gotten the bird flu. Okay, so ways that you can get the bird flu. If you touch a bird, its dander, its feces, its saliva, its feathers pop up, and then oftentimes, if you touch your eyes for humans or breathe it in, you can get the bird flu. Conjunctivitis or red eyes, that's something that's been seen with bird flu in humans, but there have been some cases where there's been respiratory involvement. And that's concerning because if the bird flu starts enjoying our respiratory system, then that shows that there's some mutations and we may be getting closer to having human-to-human transmission. So far, we have not had human-to-human bird flu transmission. And so it's really important to not play with dead birds, sick birds. If you see something or if you have to deal with the bird, make sure you have on proper protective equipment, the gloves, the masks, all of that. Also, if you are around cattle, same thing, especially if there's suspicion of bird flu, you don't want to touch them directly. You want to avoid surfaces where any of their secretions have been involved. And as far as ingesting, you don't want to drink raw milk at this time, quite honestly, because if an infected cattle has the bird flu, if he's been infected, it could be contaminated milk. We do know of cats who've gotten the bird flu from drinking milk. And there's a suspected case of a human baby that he got the bird flu. That one's not confirmed from human milk. So you want pasteurized milk, okay? That's been handled in a way to kill bacteria and viruses, not raw milk at this time, if you really want to be safe from the bird flu. And as far as eggs and poultry, I feel like the grocery stores and the poultry factors have been doing a pretty good job of figuring out when the bird flu is there, and then they halt their delivering of eggs and of poultry to the grocery stores. But just in case, make sure you cook all of your chicken and your eggs to at least 165 degrees Fahrenheit to prevent getting the bird flu. All right. All right. Any comments as we move on?
Yeah, Sheree here agreed with you about the cats. She said you can also get it from cats that have it. Watch those cats that have red eyes and conjunctivitis.
Oh, Sheree. Yes. You know, because I'm talking about drinking the milk, but you're right. Watch out for the animals also. Okay. If they've been in contact and they come lapping around you. Thank you for that.
Mm-hmm.
Yep. All right. So now as we move on toward the end, we're going to do a 5-minute health check. And this is where we'll just kind of do a little rapid fire where I'll hit on a couple of more of the topics I want you to make sure you take with you throughout the week until we meet for next Medical Monday. But make sure for everyone who's a member, just check just a little later this afternoon. Again, I will give you that sneak peek of my interview where I was on Good Day Atlanta with Caitlin Pratt, and we talked about health headlines there. Also, I did record the Portia show last week. I'll let you know when that airs. But if you check out my social media platforms, you'll see where I gave a little bit of previews. Some other things I've been up to, because you remember on other social media platforms, I typically have different information. And so just last night, I posted something on the 15 worst foods if you have high blood pressure. So check me out on other social media platforms. Give me a follow there as well. The other thing, we know that February is Heart Disease Awareness Month. I do have plenty of short form content on heart disease, but remember, and I talked about that on Good Day Atlanta as well, that 80% of cardiovascular diseases are preventable. So make sure that when it comes to diabetes, living with obesity, smoking, having high cholesterol, consult with your doctors and try to control these modifiable risk factors, okay? And a big risk factor for hypertension, a big risk factor for heart disease is hypertension. And y'all know I'm a board certified high blood pressure doctor, kidney doctor, and I've also written a book, Under Pressure, A Guide to Controlling High Blood Pressure. Come to my website, dr.frita.com. I talk about not only medicine for treating blood pressure, but I talk about a holistic treatment as well, using food as medicine, exercise as medicine, deep breathing as medicine, the holistic approach I cover in this book. And so again, for those of you who are members, we're going to have our members only live coming up next Monday, right after our routine live. Write your questions. I already told y'all, I like to learn a lot about a lot. And more importantly, I like to share the information. So take advantage of this live where you can ask me questions back and forth, pick my brain. That's what your membership is for at that level. Make sure you click a link in the description and come in, see what level you want to join us at. You get your members only videos, okay? And I did another video last week as well. What was I even talking about? Oh, I know. I recorded myself as I was at the studio for a different show. Child, I don't know what I'd be doing. But anyway, so make sure you click the link in the description. And then for those of you who want to do just a one-on-one conversation with me, I have a telehealth concierge service. Now for that, HIPAA is in effect, total privacy. It would just be one-on-one where I'll do a full history. I can give you a second opinion. I can give you information on as a first opinion, but I have been having very great success. We've been having very great success with the telehealth conferences. So I can talk to you from anywhere in the world. Again, go ahead, please hit a like, and then let's get into this 5-minute health check before we close out.
All right, Dr. Frita, before you dive into that, Marina wants to know, is joining the same as subscribing?
No, subscribing is totally free. Okay, hitting that subscribe button and then hitting the bell so that you get a notification, totally free. So being a member is where you get some extra VIP perks. So if you're a subscriber, I will still come on here every week and give you the lives, and you still will have full access to the hundreds of videos that I have on medical information, anywhere from nephrology to high blood pressure, to infections, to cancer prevention, all of the information. If you subscribe, that's totally free. If you become a member, that's when you just get a few more VIP perks like special shout outs, custom emojis. You have access to members only videos if you join in at a mid-tier level. And then at the top level is when you get a chance every month to have a full members only live where you can just ask me questions back and forth. A family member told you something, you're worried about what your mama's doctor said. Now, what I give does not replace your physician's advice, but listen, anyone who's been on the lives and Shador knows, I will give you information, evidence-based information from my decades of experience, and you have a chance firsthand to ask me questions during the lives. Take advantage of it. But yeah, the memberships have cost.
All right, thank you, Dr. Frita. You want to dive into our 5-minute health? Quick health topics.
All right, do you have those clips up?
Yes. I do.
Okay. All right. Can you hear me?
Yes.
Okay, good deal. All right. So let's see here. The flu. So y'all know we've talked about the flu, but guess what? The flu season now seems to be one of the worst that we've had. And one of the reasons we think is because people are not getting vaccinated the way they should. The way that the CDC recommends, the way they recommend, your choice is your choice. So right now in the US, about 44% of the population has been vaccinated. What the CDC's goal is to have 70% of the people vaccinated. The other tough thing is that it seems like the flu vaccine is not working as well this season as it did in prior seasons. And I do know some people who still got the flu, even though they got vaccinated. Chances are that their symptoms weren't as severe as they would have been, but a lot of people are just kind of pushing back and not getting the flu vaccine. But just remember that talk with your doctor about getting the vaccine. The CDC recommends anywhere from 6 months to full adulthood that, you get the flu vaccine once a year. And in order to protect yourself from the flu, in addition to getting the vaccine, good hand washing, making sure that you wash down surfaces because flu can be passed on door handles, on elevator buttons. Wearing a mask, can keep you from getting the flu. The N95s for sure, but even surgical masks can provide some protection from the flu. So just know, look around, the flu vaccine is going on. If you haven't been vaccinated, it's still not too late. We typically recommend getting the flu vaccine before Halloween. Okay, flu before boo, but it's not too late. So so that's just one thing to check out, the flu. Okay. All right. Measles. So this takes us to what I was talking about. We've got measles cases right now. Now, when you have your measles vaccine, which if you've been living in this country and you've gone to schools, is something that has been actually required. A lot of us remember, you have to have your vaccine card filled. You had to have the measles vaccine, MMR. And if you get the 2 doses of the measles vaccine, it gives you well over a 95% protection from getting the measles. Measles is a virus that can cause a rash, can cause a fever. It can cause death. Okay. Well, you have an outbreak right now. We have one in Texas in a particular county. And when we take a look, in previous years, like previous 5 years, 13% of the population did not get vaccinated. Well, now we're up to almost 48% of that population not getting vaccinated. And guess what? They're having a measles outbreak. Almost 30 people have gotten the measles, 9 have been hospitalized. And so this just lets you know what can happen if you don't have protection from the measles, because again, you have over 95% protection if you get both of the shots. Measles is not one of these brand new shots. Okay. It's been around. We saw how many people died from measles before vaccines were invented. And so be careful, look around. Now that we have government sites that are up giving us medical information, just go look on the sites or even Google measles outbreaks to find out what's going on in your community. Talk with your doctor. I do recommend that you get the measles vaccine. That's one that's tried and true. And no, we have no evidence that measles will cause autism. That is something that's been debunked for decades, but you still have certain people, even ones who are now appointed in high government positions, who are still spreading the untruths. And unfortunately, it can come to situations like this with a measles outbreak. That's in Texas, so check that out. All right. And y'all, I get tired of talking about food recalls, but it seems like every time we turn around, last week we were talking about the broccoli recall. Now there's a recall on tuna, some tuna cans, because why? And we talked about this. One of the sources for tuna, for botulism, can be improperly canned foods. And so there were some cans of tuna believed not to be properly canned. And now it's believed that they've caused some botulism. And when we talk about botulism, we're talking about, it comes from the bacterium Clostridium, and it can release spores, toxins that can cause you to have a paralysis, okay, where your muscles don't work, difficulty with vision, blurry vision, slurred speech, and it can even lead to you not being alive. Botulism is very serious. And I want someone in the chat to also put, what cosmetic procedure did we talk about here a few episodes back? What cosmetic procedure can also cause botulism if it's not done properly? Either way, make sure you look it up, find out if your tuna that you eat is on recall. And if it is, Lord help us, don't eat it. Don't get botulism. All right. What else do we have? Anything else in our 5-minute check?
Yes, ma'am. This is the last one. Oh, real quick, B Hall chimed in. Botox.
Botox, that's right. Now, if you're dealing with some FDA approved Botox and you're at a board certified dermatologist office, esthetician, or someone, even if not an MD, someone who has been properly certified and who has gotten a proper FDA approved Botox, then you're not likely to get botulism. But we know that there was an esthetician who was not certified to give it and who was getting his Botox from overseas, and he had several patients who had botulism, and they reported their symptoms to him. Oh, I got slurred speech. Oh, I have blurred vision. And he was like, oh yeah, that happens sometimes, trying to protect himself. Oh, they arrested him. Okay, he's locked up. They won't let him out. They might let him out. But yeah, so it's really the fake or the counterfeit Botox. I can give it to you. All right, but you move to the front of the class. Y'all make sure y'all like this video and share it before y'all head out of the door. All right.
The last one, Dr. Frita.
Oh my goodness. Let's see. Now, what is this one? Oysters. Okay, put a 2 in the chat if you like oysters. And I'm gonna put a 2. I don't like raw oysters, but I do like char-grilled oysters. Okay, one of my besties and I went and had some oysters the other day. But unfortunately, some oysters have been associated with norovirus. And look, put in the chat if y'all remember what celebrity, what rapper and reality show star had a recent bout of norovirus. I posted on it. Oh my gosh, it went crazy on my Facebook. Like well over 1 million watched it in a short time where I was talking about symptoms of norovirus. But so oysters can carry norovirus, and this virus can cause extreme diarrhea, vomiting, weight loss, dehydration. Fortunately, it tends to be short-lived. Like your symptoms will get better within the 3 days, but make sure that you're careful. We know that some oysters have been carrying it. So again, look it up. Now you can look on your federal websites for health and find out which oysters you need to be afraid, or just be careful about, because they will tell you what location the oysters have been found to have norovirus. Here's what's very important. Make sure you remain hydrated if you have these symptoms, okay, of norovirus. And again, the symptoms in most healthy people, it'll get better. But if you're elderly, over 65, very young, if you're immunocompromised, cancer patient, if you're pregnant, then I recommend consulting with your physician if you have symptoms of norovirus, okay? There's no specific treatment other than just supportive treatment. Hydration. And if you find that you're vomiting and the diarrhea, if it's not getting better and it's been at least half the day and you can't keep anything down, even fluids, again, consult with your doctor because you might need some IV hydration. Very importantly, norovirus is not easily killed with hand sanitizer. Okay, so you want to make sure you do frequent hand washing if you're dealing with norovirus. And norovirus is the most common cause of vomiting and diarrhea in the United States, which is really wild. And they call it cruise ship virus because once norovirus is on a cruise ship with all those people in tightly confined spaces eating all day and all night, it will run through a cruise ship like Johnny Be Good Tonight. All right, did anybody remember which rapper had norovirus and shared?
Couple people chimed in. Justin Bieber. Miss Sherry and Stephanie said Justin Bieber.
Oh, I didn't even know Justin Bieber had. That's not even who I was talking about. Y'all actually like Justin Bieber. I think he's been through some things. Very talented young man. I'll tell you who I was talking about. Anyone else say it?
No, Miss Stephanie said Justin Bieber as well.
Okay.
Who you're talking about?
Oh, I was talking about Lil Scrappy. That's who I did a post on back when he said at least 2 of his kids had it. I got to look up Justin Bieber. Ooh, that's miserable. Okay, I'm sorry to hear that. But all right, I believe that wraps up our 5-minute health check. Okay, so I'll be doing that where I just kind of give you guys your assignments on how to kind of stay healthy throughout the week. Remember, stay tuned. Follow me on social media. On Instagram is where I will usually post when I'm doing national news shows, media appearances, speeches, things of that nature. And on my other social media platforms, I have a lot of short form content where I give you quick bites of information. Again, make sure you please like this video and share it and check out the memberships. Okay, it has a high value. I know you will enjoy it. And I thank you to all of my members who are here and supporting. And I thank you to all of you med heads who come here and who support me every week, including my good folks in the replay crew. If you're in the replay, please and go ahead and comment and answer some of these questions as you're watching the replay, and make sure you give us a like and a share as well. All right. Well, this brings us to an end, Shador, of today's Medical Monday. Thank y'all for hanging with me. Thank y'all for all of your patience. Thank you for all of your support. And I will see you next Monday, same time, same place. I'm Dr. Frita, and I thank you for making Monday your healthiest day of the week.
Thank you, Dr. Frita.
Thank you.